Hello, everyone, and welcome to Autoimmune Holistic Nutrition Masterclass. My name is Tim, and I am the Director of Academic Communications here at AFPA. And I'm so glad all of you could join us today. And I'm super excited to also have our two guest presenters here today, Dr. Deanna Minnick and Ebony Williams. Thank you so much for joining us, you both. All right, we're going to go ahead and give everyone about 2 to 3 minutes to come in and get settled. In the meantime, for those of you who are already here, we'd love to hear from you. So in the chat box, I'd love it if you could just tell us what motivated you to sign up for this free training, and just tell us anything that inspired you to learn more about autoimmune disease. Autoimmune disease is just so incredibly complex and pervasive, and it affects so many people all over the world in so many different ways. And both Dr. Minnick and Ebony are here to dive into the many different aspects of autoimmunity during their presentation today. And tomorrow, if you join us, you'll get a chance to hear from two other experts, Dr. Laura Zakaria and Dr. Laura Adler, who will each also be diving into different aspects of autoimmune disease. And most importantly, they'll be sharing how you can apply this information in your current practice. We'll get started with our introductions very shortly, but I do just want to take a minute to give us all a second to read some of your responses here to see what motivated you to join today. Looks like many people have, someone who has been diagnosed with an autoimmune disease, or many of you have autoimmune diseases yourself. Let's see. I want to learn more about autoimmune disease to help your clients. It's fantastic. Deanna or Dr. Minnick, is any of these responses standing out to either of you, or is anything a surprise?
I am excited. I mean, look at all the flurry. It feels like lots of enthusiasm and connection into talking about autoimmunity, which is really fantastic. I'm glad to see you all here. Looks like a lot of personal connections to autoimmune disease, which I also have. And so I can imagine why people would be signing on and spending the time to understand more.
Absolutely. Ebony, is anything standing out for you?
Really everything. Just as Dr. Minich said, just seeing how many of us have been impacted by autoimmune conditions, and just how everyone really wants to help their clients. That's really important.
Yeah.
And welcome, and thank you so much for joining us. Let's go ahead and get started with a few different notes and reminders. So firstly, please grab your notepad or open up your note-taking app, because there are going to be so many gems, and I can imagine so much information that you'll likely want to refer back to and reference later. Ebony and Dr. Minnick are sharing very practical information that you can apply in your work with your clients, so I highly recommend being prepared to take notes. Also, if you need to enlarge the window, there is an icon with two arrows in the top right of your screen. It might be in a different location if you're on mobile. I'm not quite sure where that is, but look for that icon if you need to increase the size of your screen. So a video replay will be available after each session. So if you can't hang out for the full time today, that's totally fine. We're also going to have a transcription and a closed caption version of both sessions available by the end of the week that you'll also receive a link to. If at any point you have issues with audio or video, I would recommend refreshing your page. And if you absolutely need to, try a different web browser. However, since we do have a lot of participants here tonight, we are going to be near our max capacity. You may not be able to get back in right away or at all, or you may have to wait. So just keep that in mind if you do choose to leave and come back. Please ask your questions about whatever is being discussed as it comes up for you. And at the end, we'll try to save some time for some Q&A. Also, if you do want to join us tomorrow, be sure to just come back on at the same time. There's no need to register again. So here's how the training is going to work for both today and tomorrow. We're going to start in just a minute with introductions for each of our speakers. Excuse me. We're going to be getting started with introductions for both of our speakers, and then we're going to launch a poll in just a minute, just to kind of understand a little bit more about all of you, and get to understand, again, what motivated you to come here today. Dr. Deanna Minnick is going to present first, followed by Ebony Williams. We'll launch a post-presentation poll after we're all done our presentations, and then we'll move into our Q&A. So, Dr. Minnick, I will give you some time to introduce yourself and tell us a little bit about what you're going to be talking about today.
Great. Hi, everyone. I'm Deanna Minnick, and I'm here to talk with you about autoimmune nutrition. And I hope to give you some pearls as part of that. So, Tim, should I bring up my presentation, or do you have it right there?
Introduce herself, and then we'll go ahead and into your presentation. Thank you so much, Deanna. Ebony, can you just introduce yourself briefly as well and tell us a little bit about what you're going to be talking about? I think you lost your audio, Ebony. Are you muted? Oh, no. We lost your audio. Maybe you can just try to refresh and come back in. No worries, that's all right. Deanna, maybe you can just take a minute and just, tell us a little bit more about what you're going to be talking about while we wait for Ebony to come back.
Yeah, so I've been in functional medicine for some time and have also done a lot of teaching on nutrition. I've also seen patients at the Functional Medicine Research Center where we focused on autoimmune conditions. So I want to share with you some of the root causes for autoimmune conditions and then how to address those with nutrition. So that'll be based on the science as well as my clinical experience seeing people with these conditions and also having some of those issues myself. So I'm coming from a personal and a professional stance as it relates to autoimmune health.
Fantastic. Ebony, are you back?
Can you guys hear me okay?
Okay, there you are. You're back.
All right, perfect. I am an AFPA holistic nutritionist and certified personal trainer and aromatherapist. And for me, I am here to talk about just your day-to-day when it comes to managing your autoimmune condition and how can you support yourself as well as your family or clients as they are working with autoimmune conditions. I'm very excited to be here.
I'm going to go ahead and turn the stage over to Dr. Minnick to kick off our first presentation. So Dr. Minnick, you can go ahead and share your screen and we can get started.
Excellent. Thanks, Tim. Good to be here with you, Ebony. I'm going to turn off my camera so that we don't have any conflicts with bandwidth for people. Okay. Tim, I think I'm supposed to see that share my screen.
And that says start sharing screen right next to the camera icon.
Got it. Got it. Okay. I'm so used to Zoom, I must say, that it takes me a little bit to get used to other interfaces. Okay, can you see my screen now?
Perfect, yep.
Okay, wonderful. I hope everybody is grounded into the slides now. And I know I've got a quick 30 minutes on this. And I do have a lot of information, but feel free to circle back with questions and ping me. I have an email that you could see at the very end of the presentation if you have further questions. Okay, this is educational material only. I saw that a number of you had written in that you have some personal concerns about autoimmune conditions or loved ones. Keep in mind that this is really educational. This is not intended to be therapeutic or prescriptive or take place of any guidance of any healthcare practitioner. Autoimmune conditions are serious and they do need to be attended to by, I would even say, multiple practitioners simultaneously. So just want to mention that. So the number of creativity. Here's where we're going to go in the presentation. I'm going to first start off talking about autoimmunity. What is it? That's number one. Number two is I want to talk mechanisms. So by training, I'm a scientist, I'm a researcher, and I do think that if we can understand the mechanisms and we can understand how to address something like an autoimmune condition or just anything, if we know the why, we can figure out the how or the what. And then the most robust part of the presentation is really going to focus on number three, which is nutritional aspects to modulate autoimmune mechanisms. So here we go. We're going to look at the clinical manifestations. When you walk away today, I want you to have in your mind at least 3 mechanisms or potential root causes of autoimmune conditions or dysfunction, and also 3 different nutritional principles that would apply to autoimmunity. All right, so first of all, what is it? So the immune system, I'm sure that many of you have heard a lot about the immune system over this past 18 months, right? So most of that talk has been around the innate immune system, what you see on the left here, which is the body's basic defense system that involves inflammatory responses like the cytokine storm, the recruitment of certain cell types in order to all kind of glom onto that pathogen and take care of it and get rid of it. The other side of the immune system is what you see on the right. It's more of the adaptive. It's the life-acquired immune system where there are certain cell types that mature in certain parts of the body, the B cells maturing in the bone marrow, the T cells maturing in the thymus. How many of us really hear even about the thymus much anymore, right? It's part of the endocrine system. It's part of the immune endocrine system. So the bone marrow and the thymus are really important for this adaptive or acquired immune response. I want you to keep that in mind, because things that would connect to the bone or even to the endocrine system could obviously get in and start to alter things like the autoimmune regulation, how we respond to modified material within our cells. So that's just a general look at the immune system. It's actually quite complex. It's really, even for me to put my intellectual arms around it, it's huge. And I'm no immunologist, right? I'm a PhD researcher in nutrition. So keep that in mind, that I'm really just presenting to you the tippy top of kind of what you need to know. So when I think of somebody with autoimmunity, I think of a spectrum. I think of people that I've seen who are in a flare state where they're very overactive. So they present as more of an inflammatory type of person, a lot of heat, a lot of stress, a lot of upregulation of inflammation, metabolic dysfunction. They can't sleep well. They're, just overall, just lots of excitability. And then you have the other side where the immune system has tried to perform its best. And now over time, there is this chronic state of depressed immune response. And this can also be part of an autoimmune presentation where we start to see more in the way of sex hormones being altered, cholesterol, which ties into sex hormones, the need for sleep, although perhaps also the inability to have good satisfying sleep. And also up at the top here, if you're wondering what WBC is, it's white blood cell count. And so white blood cells of various types, neutrophils, lymphocytes, there's a whole array of different white blood cells on a panel that typically, if it's too low, then it's really difficult to mount a response. So the way I think of autoimmunity is that it's on a spectrum of a variety of different presentations. And if you're in a functional medicine clinic, you might be doing some laboratory diagnosis, looking at changes in immune activity, changes in inflammation. You might even dip into the gut. And we know that the gut houses 60 to 70% of the immune system through the gut-associated lymphoid tissue, otherwise known as the GALT. And then also looking at nutrients, which play right there into all things immune system. So the typical progression of autoimmunity, I would say, follows this cascade. There is some type of inflammation, back to the Yang presentation. And then over time, there is this impairment in immune response where sometimes there might be flares. I think that if you have autoimmune conditions or you've had them or people with them, they talk about their flares, meaning that they might be in what seems like remission or not a very active phase, that Yang phase, and then all of a sudden they flare. They go into some bout of whether it's psoriasis or some type of joint pain where it takes weeks, if not months, for that to subside, or sometimes in the preclinical early stages, sometimes days. Then over time, there can be a degradation of tissue, of joints, of whatever the organ system is that's involved, and then ultimately declining function. That's where we circle back to what is functional medicine. It's getting back that function, right? So there are so many different clinical conditions, and autoimmunity is like a mosaic. So it's almost like when there's one, they can present and change into another. Or many times what I saw in the clinic is that it wouldn't just be one autoimmune presentation. There would be maybe alopecia, Sjogren's, and maybe Raynaud's, and they would all kind of come and go. They would manifest differently in that person. What the underbelly of all of it is that there's some kind of modified material, some kind of cellular material that the body's responding to. It's not that we're attacking ourselves per se. We're actually attacking what is not us, something that has been modified. So it's not like our immune system is turning against us. I think that there's that perception out there that, oh, our immune system isn't working well. Well, it's trying to work, but we have modifications to various organ systems or proteins or enzymes that our body is reacting to, and it's portraying in this particular fashion. Now, one thing I do want to share with you is that autoimmune diseases in their true sense, as you see on this list, and by the way, if you want to see all of the different diseases, you would go to this website up at the top. But what we saw in the clinic and what you also see in the scientific literature is that autoantibodies, in other words, these indicators in the blood that the body is already starting to react to these modified components, typically present 7 to 14 years before the onset of a clinical condition, where you actually have a diagnosis. And so keep this in mind, because there are ways to track these autoantibodies, whether it's for rheumatoid or lupus. So many of these different conditions have very specific autoantibodies that can be tracked. So you can stop it earlier and get to that root cause and then course correct. So speaking of root causes, this is where I put most of my energy as a scientist, right? Why do things happen? Number one, inflammation. Inflammation directly connects to our immune function. So looking at what are some of the root causes of inflammation, there are so many. And so it could be everything from an infection, a trauma, toxic load, reduced nutrient status, imbalanced nutrients. And how does it present? Well, and the classical signs are rubor, color, dolor, tumor, right? This redness, heat, pain, and swelling. But sometimes we don't always see that outright. It might be a very low subclinical level. So again, the earlier we can identify that presentation, the easier it is to find our way back. And then, of course, there's all this different, the spectrum is kind of my word for everything I do. And you see a spectrum within inflammation, right? So you kind of have the low level kind that can occur just naturally as we get older. You can have the kind of inflammation that happens after a very high fat, saturated fat meal. That's called metabolic endotoxemia, especially when we have a gut microbiome that's not in balance. You could have an infection. There might also be heightened coagulation for a number of different reasons. So in the literature, that's been called coagulaging, much like inflammaging. And then, of course, the acute high inflammatory flares that I spoke about. Now, other root causes, and you have to be a detective when it comes to autoimmune disease, like what actually triggered this, right? I usually go to the point of what is the person eating? What is in their food supply? And then I begin to think about the body in a variety of ways, whether it's the gut microbiome, and it's not just the gut, it's also the oral, the nasal, the vaginal. There are so many mucous membranes where we could have invasions of pathogens, right? And that could set the immune system alight with inflammation. Genetics, some of us are just going to be more predisposed to certain things more than others. I remember one of our patients in the clinic, we couldn't understand it. She had autoimmune presentations of various types, and she was always inflamed. I mean, she even had red hair, very fair skin. And when we did her genetics panel, we saw that she already had a gene variant that made her predisposed to being inflamed. So the moment that we identified that, she almost had this sigh of relief, kind of like, wow, It's nothing that I just keep doing over and over to myself. It's something that constitutionally I'm going to, for my life, have to take care of. So genetics do play a role. I don't think that they're the be all and end all, but they can help us to make sense of why our bodies work in a certain way, especially as it relates to our detoxification pathways, immune system, and inflammation. Hormones can do it, and that's why you typically see women going through their perimenopause and menopausal period. They start to get autoimmune presentations. You also see women who are cycling and having their menstrual period, having flares at different times of the month, or even women when they're pregnant go into remission, or all of a sudden they form an autoimmune condition. Why? Well, there's a hormone shift or change. And then we need to be looking at, of course, nutrition, overall digestion and assimilation, infections and viral load, lifestyle, and toxin load. I feel very passionate about the final one, and that's something you're probably going to hear more about tomorrow. So let's dive into all things nutrition. This is where we're going to spend the most amount of our time. As you can see here, immune function can be compromised through diet, environment, and lifestyle. I would say that this is our locus of control. This is where we can start. And everybody has a different pathway into how they can work with this, right? So, you know, stress feels like the big hairy monster. It feels like, wow, that's a big one to try to control. So how about I focus on my physical activity, which I can control a little bit better, or my sleep, or whether or not I'm drinking alcohol. So all paths lead to better immune function here, right? So I'm going to break this down into a couple of different sections so that we can understand and put our big collective arms around all of this, because it's vast. The first one I want to talk about is food and the distinctions out there on any kind of reactions to food, because one of the things that I have seen clinically is that autoimmunity of various types seems to be implicated in some kind of reaction to food. Not for all of them and not all equally, but there is definitely a spectrum of either intolerance, sensitivity, or an outright allergy. So food allergies, right? Factors that are associated with less food allergies would be actually having more microbial exposure, growing up in a larger family, having pets, being in a rural area, and having a healthy microbiome. So, and we can change in our food allergies throughout our life cycle. I have noticed that people will say, Deanna, why is it that in my 30s and my 40s, I can't eat the same foods that I was eating when in my 20s? Well, your immune system has changed. It doesn't stay static. In fact, it's probably one of the most rapid systems because it constantly has to interact with the environment. So if it doesn't have reserves or the bandwidth it needs, it can't process, it can't take in that antigenic load from your food. So intolerance and sensitivity, they're a little bit different than an allergy. An allergy is an outright immune recruitment of cells, right? We tend to think about an IgE, IgG response to food, whereas food intolerance might be you get bloated or you know, some kind of gastrointestinal type of issue as a result of taking something in. That might be because we don't have an enzyme. It could also be, if I think about non-celiac gluten intolerance or sensitivity, that would fall into this bucket. And gluten is something that I definitely have seen that people with autoimmune conditions seem to have a sensitivity to. Do we know why that is? I think we're still trying to understand that. You know, is it the glyphosate that's in the wheat or the grains that people are reacting to? There's so many different postulations. And I would say that it's good to try to understand that. But in the meantime, it's probably best just to avoid gluten. And what I have found with people with autoimmune conditions is cycling their food, making sure that they're not eating the same thing over and over again, because they tend to form a lot of fear around food because of this whole thing with immune reactions. Now, here's a study looking at psoriasis patients, and they tried just to ask them about their different dietary practices, and they found that there were different levels of improvement after different aspects of their diet. So as you can see here, going from the greatest number to the least, that there were improvements when they had reduced or omitted alcohol, gluten, nightshades. Nightshades are definitely another one, right? Tomatoes, eggplant, potatoes, chili peppers. Definitely, I have seen probably like 10 to 15% of people have some kind of joint response to nightshades. And that's just more like a clinical estimation. If they've added in fish oil or omega-3, they have a nice reduction. They eat more vegetables, they have a reduction. They take vitamin D supplements, they have a reduction. So you can see here that if you start to increase or decrease certain things, depending on what it is, you put all those things together, you can start to see some dramatic shift. And that's just looking at psoriasis there. Here are some very reactive food ingredients, and I'm listing, food becomes more complicated when we have autoimmune conditions sometimes, right? Histamine can lead to the redness, the inflammation. So I'm also putting here, this is something I've had to explore with people that have autoimmune conditions, is to veer away from histamines, just in case they may respond. Now, when people have autoimmune reactivity, so in some way their oral tolerance is disrupted, what can happen is that we take in foods that might actually look like the very proteins that our body's responding to. That's called molecular mimicry. So in other words, there might be milk proteins that might look like some of the proteins in the body that are actually causing the autoimmune reaction. So to get rid of those major offenders like milk and gluten or wheat is a good first step, just to prevent any kind of cross reactivity with body tissues. And there's also one, Dr. Karazian talks about whether it's soy and thyroid. There are certain things, once we have this hyperreactivity and then we take in foods that seem to have similar sequences, that we can get a similar upregulation. So that's food. I also want to briefly interject here. I've already talked about inflammation, but let's just quickly talk about some of the nutrients. First of all, what do we remove? What is inflammatory in our food supply? A number of these things that I've listed here, right? So sugar is the big one, because when we stimulate glucose and insulin, we can get cortisol. I mean, it's just this whole pronounced cascade of all things inflammatory there. So these are just some of the bigger offenders that I have seen and that I take out in an elimination diet. Conversely, I bring in certain things that help to balance inflammation. Things like omega-3 fatty acids, which people tend to be too low in, antioxidant vitamins and minerals, different vitamins. I'm going to get into those, like vitamin D, vitamin K, quercetin, and other types of plant compounds, which can be very balancing and modulating at the cellular level. So an anti-inflammatory, and I would say an immune balancing food plan might encompass these elements. Number one, being gluten-free. Number two, being low in sugar. Number three, being high in phytochemicals, again, the balancing act within the cell. Number four, to also have a greater amount of omega-3s relative to omega-6, which we tend to be too high on. And I would say, if you were to ask me, hey, Deanna, what does this look like in terms of like a dietary program or like a recipe book? I would say it's going to look more paleo, meaning probably more protein, less carbohydrates, more vegetables, probably less fruits in some ways, but not total omission of fruit. And to eliminate some of the major allergenic offenders like soy, corn, dairy, wheat, shellfish, nightshades. You can see how we start to whittle things down. And this is why I talk about micro rotation with autoimmune folks, because they get so much fear about what they can and can't eat that I have to, first eliminate, and then we start bringing things back in very small amounts so that they don't feel the fear of not being able to eat just different items in their food supply. So gut health, I do want to talk about that briefly too. It's really important to be thinking about the gut. Leaky gut, you probably heard of, but in the literature, we also see leaky brain, leaky skin, leaky heart is even in the gut. So in other words, we have a lot of leakiness going on, which means that we've got some issue with permeability. Our cells are not tight in integrity. They're not able to keep their boundaries and borders, which means that they're not effectively able to transport or retain nutrients or even perform well functionally. there are some lab tests for assessing intestinal permeability. And there are nutrients that may help to establish a better integrity, a better integrous gut lining. So if you look on the left, these would increase permeability. And this doesn't mean that it's all bad to increase a little bit. Sometimes we need that. And then on the right, decreasing permeability, what restores the integrity of the gut. So if we just focus our attention to the right, basically we need glutamine, we need some healthy protein, we need some vitamins, we need some plant compounds, and we need certain short chain fatty acids, which would come primarily from prebiotic fibers, right? And zinc, I think, is also really important. This is coming from an article where I just extracted some of the cell studies that they had reviewed. The gut microbiome, you know, is a big deal. This is the seat of our psycho-neuro-immune endocrine system. And so if we want to get our immune system right, we need to get our gut on right? There's so many things that the gut is responsible for. Perhaps we have another webinar just on the gut microbiome, just to really drill into that. So as a result of, oops, that was an automatic advance there. As a result of the gut being so important, it's important to also focus on stress, because one of the things that causes flares in people with autoimmune conditions or symptoms is stress. Stress, absolutely. You ask anybody with any kind of autoimmune condition or presentation, they will tell you that stress causes an exacerbation of symptoms. And it also causes changes throughout our body, right? Especially in the gut. So the more that we have these repeat stressors, whether they're brief, they're chronic, they're going to impact the immune system. So to be thinking longer term, you know, how do we understand our stressors and to start to form a different mindset around them? Because most times we won't be able to do a lot about many of them in our lives, but there can be a way to approach them differently. And that will be more healing for our immune system. So as you can see here, there's even literature to suggest that there's a role of psychological stress and stress-related hormones in autoimmune disease. There's a connection, as I've mentioned, between immunity and these inflammatory cytokines, which can get perturbed with stress. So we've got to be talking about that. We've got to support stress processes in the body using nutrients. If we can't do anything about stress, let's at least give our body the buffer it needs to deal with stress better. So protein, healthy protein. And sometimes this is where I like a protein powder because it's more digestible. And when we're stressed, we're not digesting really well. Omega-3s to pull us back into balance, B complex for energy, vitamin C to help us support not just the adrenals, but also the brain. The two highest concentrations for vitamin C in the body are brain and adrenals. And then, of course, minerals like magnesium and calcium can be supportive. So in functional medicine, we have the 5R approach to gut health. I'm not going to get into the minutia of that, but there is a way to work with a functional medicine practitioner to sequentially get in and start to heal the gut. And to, and as you can see to the lower right, rebalance it as well, so that when there are stressful events, that the gut can withstand those stressors. All right, so moving into the macros, micros, and phytos, right? Most Americans lack immune health nutrients in the diet. This was published last year, 2020. Basically, Americans fare very low in terms of taking in nutrients. There is a high degree of nutrient insufficiencies and deficiencies, especially for very relevant immune-related nutrients. Things like vitamin A, which I think we've heard way too little about over this pandemic. We've heard a lot on vitamin D, but not a lot on vitamin A. We could have heard a bit more on vitamin C. We've heard a lot on vitamin D, vitamin E, and of course, we've heard some fair amount on zinc, but we're low in all of those things. So early in 2020, Dr. Patrick Hanaway and I wrote an article on the functional medicine nutritional strategies to COVID. And these strategies would apply to autoimmunity as well. Balancing inflammation, reducing oxidative stress, increasing antioxidants, and harmonizing the gut microbiome, right? So how do you do that? You eat plenty of fruits and veggies as much as you can. And if you don't eat a lot, then just make sure you have nutrient density, that you're making the most of what you take in. Fiber, fermented vegetables, and reducing or avoiding what sets off inflammation like sugar, and especially in autoimmunity, salt. Salt is a culprit in terms of looking at the Th17 system. And so there are certain types of autoimmune related populations or conditions in which salt would be not advised. So some other things, this is not from us through that article, but through a different article, which was basically saying very much the same thing. So you're going to find a lot of the similar features out there. One of the things I've been talking more and more about is variety. Change it up. We get into these food ruts, right? And the gut microbiome needs resilience. It needs diversity. Diversity is a principle of nature. And for us to be in harmony with ourselves, we need to mimic what's in nature. Diversity, variety, these are essential concepts for the immune system. So for somebody with immune issues, I would say to start tracking variety through the week and aiming for 50 unique foods in 7 days. And that can be categorized based on these here. So I've written an article and I've talked with you all before about eating the rainbow. And why is that important? Well, each of the colors has a functional signature. So just keep this in mind as we think about autoimmunity. Typically, when I think of autoimmunity and immune health, I think of the red colored foods, but truly you need the spectrum because each has their own imprint as to what they do within the body. So this is my big summary. I had this on social media somewhere if you want the actual graphic. But in the interest of time, I'm not going to weed you through each of these. I'm going to just skim through each section very globally and give you the high level. Fatty acids, I've already talked about how important those omega-3s are, right? Because an ultra-processed diet, yes, we've actually come to an ultra-processed diet. It's no longer even a processed food. We've gone to ultra. And in an ultra-processed diet, all you have are ingredients and additives and synthetic agents. So we're missing out on these essential fats like omega-3s, which can be anti-inflammatory and immune health promoting. Essential means that our bodies don't make those. So if we miss them, our hair starts to fall out, our skin starts to get flaky, behavior goes awry, mood goes down into depression, learning issues. You know, my whole PhD was on essential fats, and I can tell you, you do not want to be low in essential fats. I mean, every cell in your body has a membrane, and that membrane determines its function. So that's why I start with fatty acids, because it's really the bedrock of our cellular activity. I'm not going to go through this. This is just a cascade of fatty acids showing you how there are different families of fats. So the essential ones are the omega-3 and omega-6. What are some food sources of omega-6? Now these, we don't want to forget about omega-6 because they are essential, but again, people are getting too much. And you would say, well, wait a minute, Deanna, I don't see that people are eating these oils that you have here. Well, then there are also highly processed oils, vegetable oils like soy oil and corn oil that contain a lot of omega-6. So these are the healthier options, I would say. Omega-3s can be found in plant as well as animal foods. So fish is usually a greater source, but you can also find it in greens for people who are not eating animal foods. So I think balancing this, and when people say, well, Deanna, how do I know how to balance? Well, you can get a blood test. You can just go through like an Omega Quant, spend $50, give a blood sample, and basically get your ratio. And based on that, you can determine how to adjust your diet and also how to supplement. It's best, obviously, to do that with a healthcare practitioner who's obviously trained in that. And so making sure also never to cook with those oils. In fact, I don't use any oils in cooking because I don't want to damage the oil and create rancidity. I use water or steaming for that. Vitamin A, again, I'm a huge fan. Retinol is it's the active form of vitamin A found in animal foods. If you don't eat animal foods, you can get it from plant-based carotenoids, which convert to vitamin A with some efficiency. Why do we care about this with autoimmunity? Because really important for maintaining the integrity of mucous membranes, helps with that first part of the immune response, the innate immune response, helps to reduce susceptibility to infections, and helps with reducing the risk of respiratory disease. I just think it's It's incredible. It's one of like the top deficiencies on the planet. And you can see that groups like Vitamin Angels, where they are really keen on vitamin A because of vision and blindness. But vitamin A is also very much connected to infection, the immune system. And typically you'll see a deficiency of vitamin A in those populations with low protein or not even having plants, so that they're not converting. So I have some food sources here. Vitamin D, we've heard a lot about. I'm not going to belabor this one. We know it's extremely important for autoimmunity and immune health. In fact, in the clinic, this was one of the things that just about everybody was on. I live in the Pacific Northwest. We don't get a lot of sunlight here. Everybody was low in vitamin D. I almost felt like we were taking their vitamin D, like the few droplets of blood had contained their vitamin D because it was so little. So it's difficult to make sure that we have appreciable amount. So vitamin D is important. I do think it's important to test and not guess, however, on vitamin D. Vitamin D works in relationship with a bunch of other types of nutrients, right? So we don't want to just do shotgun approach of certain hormone like vitamins, like vitamin D, which is fat soluble and can get to a level of toxicity. It's easy to test. It's inexpensive. It can be done by most healthcare practitioners. Food sources, you can find mostly in animal foods. Vegetable sources, you'll find the D2 form. Vitamin C, I'm a big fan. Also for the immune system, it's an antihistaminic agent, which means that histamine is broken down by vitamin C. So for people that do react to histamine containing foods and have that kind of reaction when they eat, vitamin C, taking that with the meal may or may not be helpful for that individual. It's also important for collagen synthesis. Most people don't realize that, and even neurotransmitters. So not to kind of go through all the minutiae of this, but as you can imagine, vitamin C is very important for the immune system. There's been a lot of research on it. For those with high stress or people that smoke, really important that they are getting and repleting their vitamin C. We don't make vitamin C. Our body doesn't make it, so we need to get it from the diet. It's like essential fatty acids. Zinc. We've heard a lot about zinc. It's important together with vitamin A, vitamin E, and even vitamin D to help with mucosal membrane integrity. It's needed for that innate immune response. And it may help to reduce symptoms of different types of infections, like in this case, this study here, symptoms of the common cold. Lots of different, I won't go into it, but just to say that I do think that zinc is important. Zinc also competes with heavy metals, right? So the more that we can increase minerals in the diet or through supplementation, which can be verified through blood testing and, obviously working with a healthcare practitioner on that, but essentially zinc can compete and start to take the place or at least sit in place of those heavy metals. So it's a nice dynamic there to be sure that we are getting sufficient zinc. It also upregulates something called metallothionein, which can bind heavy metals in the blood and prevent them from interacting with organs. We also want to note that there is a tolerable upper level. Just because I'm featuring these minerals or this mineral, zinc, and vitamins and saying that they're good doesn't mean that more is better. There is a threshold of safety. So we need to consider that. This is why I always prefer food sources over supplements. So I have in here just some general recommended intakes. This was according to an article that had come out in 2020, giving just general recommendations. These are not personalized at all. Again, blood values to first test and figure out where people are at. And then I'll close on phytonutrients. And this is where I like to teach mostly in terms of the literature. We can see that plant compounds, there are so many of these phytochemicals, and they're doing so many different things at the level of the cell. Carotenoids, a family of about 700 different compounds needed to convert into vitamin A. We can also use them to help with oxidative stress. Catechins modulate mood. They are part of the flavonoid family. And so they act as an antioxidant, much like curcumin and turmeric. which are not only antioxidants, but also help to balance inflammatory response. Quercetin is what's called a zinc ionophore. It stimulates the entry of zinc into the cells. And resveratrol is also wonderful. It helps with a number of cellular processes relating to metabolism. So just even this small sampling could be very robust. So during this past year, I've started to take pictures of my meals to show how you might put all of this into motion, right? So I live in an area of the country where we have a lot of fish. And so here we have wild caught salmon for the omega-3s, which you can also get from spinach and leafy greens. Sauerkraut, I have fermented vegetables with just about every meal. Not great for everybody with immune conditions, however. They may contain slightly more histamine that some people might respond to, so you have to gauge that. Sweet potatoes for carotenoids. And there are a lot of spices on this, by the way. You just don't see them outright. Greens for a number of the different compounds. I didn't mention this, but magnesium is required for the conversion and activation to the active form of vitamin D in the body. So low magnesium means that all that vitamin D that people could be taking may not actually manifest into the activated form. You need magnesium to work best with vitamin D and to have that activity. Shiitake mushrooms for immune modulation, they're great adaptogens. And I do want to mention and close on this point. I get this question all the time. So I thought rather than have somebody ask, I'm just going to put it up here. And I just posted on Instagram and my Facebook page on some ideas for this. So people always ask, well, Deanna, you just talked a lot about all these foods and potentially even supplements. So what if I don't have a lot of money? How do I stay healthy despite the fact that I can't spend a lot of money? Well, so I crowdsourced this question within one of my online communities and came up with a number of different strategies. I'm listing a few here, but actually in the social media post, I have actions, and then I have other foods as well, like sprouts aren't on here. The spices are on here. There are a number of different things, and I'm sure that you could think of things for yourself, but I do think that there's a way to do this. So in summary, the autoimmune nutrition prescription, what are potential takeaways, right? Number one, figure out root causes. And I think you're going to hear more about toxins tomorrow. And that's where a lot of my passion is and where a lot of my teaching has been as well. I think it's really important to look at toxic burden, digestion, gut microbiome, hormones. You can see how everything is a web, and everything needs to be scrutinized when it comes to autoimmunity. I also think it's important to take a personalized approach, not to just do what's called a shotgun approach, where you just do everything simultaneously and you're not looking with any scrutiny at laboratory values, or, you have to consider safety. You don't want to perturb the immune system by having levels of certain things that are just too high. Removing dietary offenders like sugar and salt, and including nutrient buffers, things like antioxidant vitamins. Consider macronutrient quality and quantity. I really didn't get into protein and carbohydrate too much, but I do want us all to be thinking about omega-3s and omega-6s. Variety, phytonutrients, making sure that we're reevaluating seasonally, because autoimmune conditions sometimes can rear their head at different times of year, which coincide with different stresses upon the immune system based on what we're getting in the environment. So we may need to shift our foods to be more in alignment with that. And then under the guidance of a practitioner, to supplement with nutrients as needed. And I have here this wheel of nutrition and lifestyle behaviors to kind of take in. And, we don't have to take it all in like a huge tsunami, but just small things, small steps as we go. So thanks, Tim. Thanks, everybody, for listening. I'm going to stop sharing.
This, but I always feel so revitalized and refreshed in terms of my interests academically and professionally for nutrition when you present. And I know I'm not alone in just sharing that sentiment. So thank you so much for all of that great information. It's incredible.
You're so welcome. Thanks, everyone.
Just for the sake of time, we're going to go ahead and skip our polls, and we're going to go right into Ebony's presentation. I am just going to push a link out to everyone where you can connect with Dr. Minnick on her website. On her website, she has a number of different downloadable resources, and on her Instagram page in particular, some of the visuals and illustrations that she shared are also on her Instagram. So if you're on there, be sure to check that out. So we may run a little bit over because I just want to make sure that Ebony has a sufficient time to cover all of her material. So we may not get to the Q&A, but Ebony, it's all you.
Hey everyone, just let me know in the chat if you can hear me okay. I just want to make sure that we're good. Perfect. All right. What I want to do now is expand upon all of the amazing information that Dr. Minich just shared with how do we take the information that we learned, the science, the research, and hearing from someone that is actually practicing all of these things, and how do we apply that from a coaching perspective and understanding what's going on with our clients. So the first thing that I really and truly want to walk you through is understanding three things. And that is, how do you even support a client that has an autoimmune disease? What is it about their day-to-day life that we have to make sure we're understanding? And then we also need to talk about social determinants of health, which I will get into in just a moment. But we have really talked about who we are in the beginning, but I myself have Hashimoto's disease, and I definitely focus on the advocacy side of things with my clients and really and truly helping them to learn how to navigate the healthcare system, because I work in healthcare currently. So I get to see the other side of it from a policy, procedure, and structural perspective to be able to help my clients figure out the best way to make sure they're getting what they need. So I want you to think about this question. And we've kind of already went through it in terms of, have you or someone you know been affected by an autoimmune disease? And from the chat earlier, you have. So I want you to think about that for a minute and really process with all of the information that we just learned about. If you yourself are asking the question of, gee, that was a lot of information. There's so much to learn. There's so much to know. There's so much to do. How on earth do I even begin the process of helping my clients? Because again, as Dr. Minich said, autoimmune conditions can sometimes cluster as well. So, and even when it comes to different lifestyle modifications and or where a person is, whether or not they've been exposed to different toxicities in the air or just in their homes, there's so much to think about. So I really and truly want you to get in the process of, first and foremost, staying on top of the information related to how we help our clients. And we already have a wealth of information that was presented here tonight, but it is our responsibility to make sure that we understand the conditions that our clients are living with day to day, as well as what does their family life look like? Because they may not be the only one struggling with an autoimmune condition, or they may be the only one struggling with that, but it's getting their family to understand that and helping their family to see, how can I support my loved one as they're struggling with this, or even learning how to go from surviving to thriving. And then what's really important is to understand that each of us, including our clients, have an ever-evolving state of being. What I mean by that is, today you can be perfectly fine And tomorrow, all of a sudden, your world implodes. Hello, pandemic. So our stressors are going to be different. How we perceive the world will be different. There's so much that we have to process through. So where can you start? There are so many more organizations that are starting to process how important autoimmune conditions are from a research perspective, from a treatment perspective, and understanding how do we partner more with our patients to ensure that they're getting what they need. And there are a few resources here. Once I go off of speaking, I'll make sure that I post those in the chat. But it's important that you're making sure that you stay on top of research. Do a very quick PubMed search, for example, and just start to understand by reading the abstract even, what are some of the key things that researchers are looking at as it relates to the mechanisms related to autoimmunity. All of those things are important. And the reason why I say go to a scientific start is because there is a lot of information out there, and I come from a research background. So my first pass is always going to say, what does the data say? What does the research say? Instead of simply going to a simple Google search and looking at a lot of the information that's out there initially, you always want to check to make sure it's peer reviewed by a scientist or doctor. And it's okay to look at those websites initially to just get a basic understanding of what's really going on. But again, you want to make sure that you're sticking with the data and that you're not inserting your own personal beliefs or thoughts or processes on your clients because they're so unique and they're different. So the next thing that I want to pose to you is, do you ask your clients about what their day-to-day routine is? The reason why this is important is because you have to really and truly immerse yourself into what's going on with your client. It's not about, well, I think you should do this, and I think you should go out and eat the rainbow and get all these things and buy all these vitamins. Well, does that fit into their current lifestyle? Have you asked them to recount the last 24 hours of what they ate? Or even from an emotional perspective, are they going through a lot? Are they having a challenging time at home? Are they a new mom and their hormones are changing constantly? Have they recently been diagnosed with their condition? Are they having difficulty sleeping at night because their medication just got adjusted? What are some of those things that we have to think about asking our clients? And whenever you're working with your clients, you always want to make sure that you're sending out information in terms of a form of some sort to gather this information from you. And I know a lot of us think, well, that's too much for me to put in a form. They're going to feel like they're at the doctor's office, and nobody's going to do that. But it's really important for you to determine, why does it matter? Why does that matter to me that I know about my client? And each of us goes into this with a desire to help others. And it's helpful to put out a disclaimer to your clients to say, hey, you know what? I am not by any means trying to get all in your business or to make you feel like you're at the doctor's office or to do anything that's going to make you uncomfortable. The reason why I'm asking you this information is because I'm trying to get a better idea of how to serve you. And no, I'm not trying to replace your healthcare provider. No, I cannot treat or diagnose anything that you have going on. But it's really important for me to understand what are the things that you can and can't have and what your life looks like. Because again, as Dr. Minish mentioned in her previous presentation, is for many of us, we can and can't have certain things. We're going through different things. So keep that in mind. Along those lines, what I also want you to think about from a client's perspective is, who are they? What are their stressors? What motivates them? What are those happiness boosters? Meaning, what can you actually talk about with them that will uplift their mood and help them to continue moving forward in their health journey? What is their why for contributing to how they're going to show up with you? And you always want to understand who's on their care team, because what's really important to consider is, a lot of times, and I hear this quite a bit when I'm working with clients, is, well, I went to my primary care to get my thyroid levels checked, but they didn't check for this. And now I'm confused because I don't know what to do. Or I went to see my GI doctor, but I forgot to get the paperwork from my GI doctor. So now I have to go to the medical records department to request this so I can take it to my primary care. And that web can get really tangled really fast. So it's really helpful, though not required, for you to understand what they're working with as it relates to their care team. Do they use an electronic medical record? Do they have a patient portal? Do they take a journal to their doctor's visits and have a list of questions that they're asking their healthcare team? Do you partner with them to make sure that they have a list of those things to write down when they go to the doctor? A lot of times we go to the doctor's office and we get white coat syndrome, our blood pressure spikes, we get nervous, our armpits sweat, and all of a sudden we forget why we were in the office in the first place. So help your clients advocate for themselves. And with that being said, it's going to be important to learn their symptoms. And the reason why you want to learn their symptoms and get to know them is because you have to be able to know when to partner with their care team. You want to be able to recognize, are they having rapid weight gain or weight loss? Are they struggling with depression or anxiety? Or are you noticing that they're using descriptors that indicate negative emotions? Are they manic in some ways? Are they really low in others? When they show up to your sessions, are they talking about more issues with food, more family problems, stress at work, just feeling overwhelmed and isolated? Are they having changes to their medications? Did their treatment change? Are they going through a food elimination process with a practitioner? Did they recently lose a loved one? Did they recently lose a friend? And are they in the middle of a flare-up, or what I like to call a thyroid storm, as I've experienced several times? And when it comes to this, you have to know, what does a flare-up look like for them? Because I really want to stress in this very moment and instance, the list that I just provided to you on this slide is so incredibly important, because I have had clients come to me and say, hey, I didn't even realize you're a personal trainer. I was just talking to someone in the gym and they were like, hey, if you work with me, you'll be able to come off your thyroid medication. But what they didn't know is she literally had just had her medication adjusted. And for her, coming off of her medication could be detrimental to her health. So with that being said, remember your scope of practice. Just because a client either loses or gains weight does not mean that it is a healthy form of losing or gaining weight, especially if it's rapid. You should not be trying to treat or diagnose a a client ever, ever. When it comes to blood tests, that is a very spicy topic, I'll note. We're not saying that you can't give them an idea of what to look for, especially if you have an autoimmune condition yourself. But what's going to be important as a coach to them to say, when you go to the doctor, you need to have a conversation about what lab values to get checked that are appropriate for your condition. Because for me, at this point in my health journey, looking at my antibodies is a moot point. I know that I have higher antibody levels because of my Hashimoto's disease. So there's no reason for me to consistently get those levels checked every 6 to 8 weeks, for example. There's no reason for that. So it's going to be really important for the client and the provider to have that conversation. And it's also important to help them advocate for themselves. Because sometimes you yourself may have heard this. When you're going to the doctor and you ask them to run a lab, you ask them to look at different things or x-rays or imaging studies, or you say, hey, I'm having really severe headaches, or I cut out all these things in my diet, but I'm still struggling. If their doctor or healthcare provider isn't listening to them, there are ways that you can go about helping them to figure out the best path to make sure that their health is a priority. There are second opinions. There are sometimes third opinions. I love going to see functional medicine providers because they tend to take more time with me as the client. And it's not to say that doctors are bad people, but they don't always have the time based upon their schedule, based upon all of the things that they have to take care of on a day-to-day basis. Sometimes it's just hard. And it's not even to say that they don't care. Looking on the opposite side of healthcare management policies and procedures, it's a lot on them. And I hear it on a regular basis. But when it comes to your client, what's important for you to do is to show them how. Teach them why it's important to document their food, what they're doing when they eat, and how they feel after they eat. Because a lot of times, many of us suffer with bloating, with feeling nauseous after we eat, with feeling tired. It's not all about, oh, you know what? I just had a really heavy meal and now I have a food coma. It's not that. You may not have the ability to process certain foods. I know, for example, I got tested for celiac disease because early on in my condition, I could not have gluten. And the intolerance for me was really, really severe. And I got tested and found out that I did, in fact, have that non-celiac gluten sensitivity. And after a while, when I took that out of my diet, I wrote down what I was eating constantly. And that allowed me to be able to say, okay, I can and can't have that. Can you teach them how to read a food label? Can you teach them how to identify their food stressors? Can you help them understand what happens when you're multitasking and eating? Or even when they're in social situations, how does that emotional impact of that situation affect how they end up eating? Because a lot of times we pair food with different things, whether it's celebrating, whether we're sad, it could be a funeral, it can be a wedding. And we often don't recognize how much pressure we put on ourselves in those situations, or even happy hours. Many people are starting to get together for those again. And it's important for our clients to understand that you have options. You can order your food first, for example, so that you don't have to feel pressure to get that happy hour special with the breaded shrimp or all of the other things that you know you can't have. So rather than you suffering later on, just order first. That's a very easy thing if you're in a social situation. And a question that I really want to pose to you is, how much do you know about the social determinants of health? The reason why that is so important for us is because it can have an impact on your clients. It can, regardless of who they are, regardless of where they come from, it can impact them. And whether it's economic, whether it's access to healthcare, your social and community context, meaning what is it like amongst the people in the area that they live? What about their neighborhood, housing, their environment, public transportation, the ability to get healthy foods, their air and water quality? All of those things are going to impact your client. And for you, in your opinion, it may seem like your clients can afford all the healthy things and all the organic foods, but that might not be true for them. From an ethnic or cultural perspective, the foods that they eat to you may not necessarily seem quote unquote healthy, but it's up to you to understand your clients' backgrounds and the foods that are native to them, so that if there are healthier alternatives that are affordable to them, you can suggest those. But I want to drive the point home of not shaming them for where they are or what they have access to. And for many of us, you may think, well, I would never shame my client. Why would I ever do that? You have to think about implicit and explicit biases as well when you're talking to your clients. Are there things that you've read about a certain community that may have had an impact on you in terms of how you approach a certain type of people? And I know that that is a very sensitive topic for a lot of people, but you have to do that internal work to understand where you fit, so that at the end of the day, your client is getting the best of you and they're learning how to show up for themselves. So with that, I'm going to go ahead and stop sharing my screen. But the point that I really and truly want to drive home is your clients are dynamic. They are not static at all, not even a little bit. So I want you to think about, how do I show up for my client, and what is my responsibility to make sure that I'm thinking about when I approach my clients? How do I really and truly help them? So with that, thank you all so much for attending today's webinar.
I want to highlight one thing you said that is so important. It's really interwoven in everything that you said. And it's really this principle of personalizing your care. And, from a functional medicine perspective, it's this idea of bioindividuality. And of course, that's referring to, the deliverance of nutritional and biomedicine and nutritional care. But the question is of, who are you? Who is this person in front of me? Is so powerful. And it's a question that will help us have compassion and empathy for the people who we work with. And, simply throwing care plans and protocols at people based solely on their diagnosis is not truly personalized or holistic care, right? It can be very overwhelming, and doing so might be the difference between your clients experiencing growth and recovery and results versus experiencing the opposite and potentially increasing, their symptom severity or advancing the development of their disease. I think just these two themes that kept coming up for me as I was listening was to have compassion and to have empathy for the people that you're working with. So very important. All right. Well, we're coming in right on time. just because we are on time. Unfortunately, we are not going to have time to get to the Q&A, but I do just want to acknowledge all of the fantastic questions that you all have asked tonight, and for all of the engagement and just all of the passion. I can hear that all of you have been so impacted by autoimmune disease and chronic disease, and that this work is very personal for you. So thank you so much for showing up. I did just send out a link to everybody to connect with Ebony on her website. Ebony does a lot of different things to help a lot of people, and you will find links to her social media and her podcast, which is excellent, especially if you're caring for people with autoimmune disease or you have an autoimmune disease. She has just a phenomenal abundance of information that will be helpful to you and your clients. So Ebony, before we go, are there any concluding thoughts or anything else that you would like to share with everyone?
I just really and truly want to say thank you to all of you for showing up today, because this is just, one, making me incredibly happy and grateful, but two, it shows that you want to do more and help your clients succeed. So I'm really grateful for all of you.
Thank you, Ebony. So just a quick reminder, everybody who is here tonight, or if you're watching this, maybe you're already watching the replay in the future, but you will be getting a link to the replay for tonight's session and tomorrow's session. And in that replay, you will not be able to download PDFs of the slides, but you will be able to see the slides. Just to clarify, there were a lot of questions for that. So, all right, well, that concludes our first session of Autoimmune Holistic Nutrition Masterclass. If you can, be sure to join us tomorrow at the same time at 6:30 p.m. Eastern Time or 3:30 p.m. Pacific for day 2 with our guest presenters, Dr. Laura Zakaria and Laura Adler. Ebony, thank you again so much for joining us. It looks like Dr. Minnick has hopped off. Thank you, Dr. Minnick, for joining us. Really appreciate all of the valuable information and practical information that you shared, and same to you, Ebony. Thank you, everyone, for taking the time to join us, and I hope to see you tomorrow. All right, take care, everyone. Bye for now.